it can be an extra set of drapes for an extra table. In this case here, we have what? What do you think it is? It's like a Christmas gift.
The lens?
What do you think you get a gift from Canada? Let's see if we can guess what it is. Is it a gown? You don't know.
Is it soft?
Is it a
Very
gift?
soft.
So it's a gown?
Maybe.
Is it a gown? No. It's a tray. All right. So is it an extra drape?
No.
It's a tray. What can it possibly be?
Wet cell sponges?
Prep.
Okay.
Why do you need wet cell sponges out of your surgical field? You need them in the field. Down, you need it in the field. Right? The only reason why it's here is so you can take it and put it on your mayo stand for surgical tech. What we've been teaching you. Put your gown and gloves on your mayo stand. In this case, this is a separate sterile technique, which is going to be your nurses. Okay, so your nurse is probably going to be, because it is this and here, it's a tray. More than likely, why do we have plastic trays? They're going to take some sort of fluid. What fluid could that be? Prep. Okay, so they can be prepping for eyes. Now they usually do use a different type of betadine. Okay? The betadine has been laboratory engineered to work for the eye. Okay? Again, you guys know anything in your eye that's not okay with the eye, what does your eye end up doing?
Blinking?
Ouch. Okay? Even water, right? That's why my Z doesn't hurt. Okay? There's certain things in there that soften your eyes. So on top of the betadine, we also are going to have water or certain fluid that we need. Everybody read what that is. Balanced salt solution. It is balanced for your eyes so it doesn't cause irritation for the eye. So also your eye doesn't retain a lot of that water and salt. So it's balanced, made for your eyes. So everything in this pack, guys, should be similar to what we have, but slightly different because of the eye. In this case, there's a sterile package. You know how to grab it. It's this color for a reason, so that you know it's not part of your sterile field. Usually anything that is white and covered like that is going to be the nurse's type of situation. So if it's a gown, no, it's a temporary surgical opening. If it's a tray, more than likely it's for the nurse because they have to prep. And if it's a big package, it's more than likely another needle setup. When you guys get to orthopedics, you're going to have a separate sheet up here so that you can set up 2 of these bad boys because you're going to have 15 instruments, okay? Trays, scissors. So in this case, that's for your nurse, right? Let's go ahead and open it on here. Can you open it for your nurse? Of course, definitely. If you're setting up the surgical field, just make sure it's not in really close reference to your surgical field. Okay? Guess what? All it is 4x4s and nothing else. Once again, why? We're going to open that appropriate saline for the eyes. Sometimes they will be in there. Again, I'm pretty sure one of those packs there is going to have all the prep. It all depends on your facility. Your nurse will actually come over here and pour the same medications for herself, not for you. Once you open this, you work with it. There's regular 4x4s, not Raytech. So you can go ahead and, like the sponge that comes in the other ones, you can go ahead and dab around the eye. You don't want to rub around the eye. You want to dab. If you want closer to the eye, then you use, you can get some betadine in here. And you use it just like you do eyeliner, right? Everyone here uses eyeliner, right?
Yeah.
All right. So set that up for your nurse. Again, would right here exactly be a good spot to open this up? No, you're setting yourself up into your sterile field. So closer to your nurse station or closer to the patient in some way. Okay? I just want to show you guys that. But now, always before you continue opening, make sure your sides are even. You can do that beforehand because we haven't opened up sterility quite yet. Yes, this is sterile, but it's not 100% sterile. It's not your base yet. Okay? Good, you can see. Watch that heart rate around the corner. Watch that heart rate, you're close to it. Now it opened up, right? So that was good. Try not to reach over your sterile fields, but it can come on this side. Okay? All right. Oh, look, there's something else here. A basin set. Yay. So, can you grab this now? Sure you can. All right. Is it best to come in when you're sterile to grab this? Yes. But if there's ever a basin here, guys, so you can grab that other wrist stand. Have you guys seen the other wrist stand?
No.
It's probably over there.
Oh, right there.
Yeah, but we ran out of 3 is what I'm saying. It hasn't been here for a while. It's probably next to this.
I just remember having the 2 and then the other wouldn't use the trash can.
Yeah, we have. I'm gonna have 2 in here. Huh? We just gotta get it in here before someone else takes it. So, setting you guys up for real world. Again, that's an area to do. Scrub in and then grab it and then open it up here. Unsterilely, reach in there for a quick second. Okay, don't come over here and be like, this. If anything, coordinate yourself so that you can grab, take. Okay. Again, what do I use? Less coverage from here compared to over here. Just grab it real quick, take. Set. Easy part after that, just like you do the basin. Okay. Okay. Wow. What if you were sterile? So you're gowned up, right? Now I'm scrubbed in. Same thing. Just stay sterile. Now you can do like you do your, right? Be careful not to touch your mirror. But now you can do what you do your draping. Sterile. Okay. The other way was then just the other way again. And sterile. So, some of you guys ask, how do I ever do that? How do you do that? Well, here's one you can practice. I'll fix that later. Okay. So inside these packs, you're gonna have simple gowns, right? One for you, one for the surgeon, one for the assistant if need be. More than likely for eyes, it's gonna be 2 drapes. You guys, some of your case goes excellent. Keep it up. So you're gonna have towels for any eye surgery. The answer is no. You don't have blue towels because of the lint factor. Anything that you do with eyes, you gotta avoid something that has lint. If you do have regular towels and you do secure, then you gotta make sure you have some sort of plastic draping so you can put over those towels. Okay? So we do have sometimes in these trays. We have sometimes in these. You have to open 4 of these. There might be in here. You have to open 4 of these. Okay, this is like an N-size type drape. Why? The towel has lint. In this case, a 10-10 or a clear drape is used instead of 4 towels. How do you apply this? Again, the same way. The sticky side is the knee. So you have knee, the last one is facing me. So when your doctor, again, this one's facing me and I give it to the doctor, your doctor receives it, thank you. You can go ahead and place it down, and the last one that's facing, you can go ahead and place it. Okay, so that's the reason behind that. So you should have 4 of these possibly. And if not, your final drape or your intermediate drape is also going to be the same material. Okay? This is an aperture drape. Okay? And of course, how do you know that? It says it has a hole there, and it's backed by plastic. And there's little feet here telling you no towards the feet. Okay? Like I said, almost every drape in surgery has directions on how to open it. Dummy proof kind of. So we'll get to work with this. And they're all different. So don't get used to, or no, Mr. O, I do not know how to open that drape. It doesn't matter because you're going to get different drapes in all these hospitals that you do. This is just one of the basic ones. Usually your doctor knows how to handle it.
Is that the same cover that would go over if you're in the process reading? To if you cover your instrumentation?
Yes.
Is that the one that you use?
No. So you have, I was going to get to that.
Oh, sorry.
Well, along with your Mayo stand, since we're there now, this have 2 Mayo stand covers. This is more of your truer one. If you notice, it has kind of this non-slip type backing. I hate it, but it works because then you grab something, it's like, oh, let go. Okay, but it's not sticky, it's just more has traction to it. So this is one you'll see in eyes. This is the actual Alcon mayo stand. And there's regular mayo stand. But then you'll have something like, again, that might resemble a mayo stand, but it's clear. Literally, this one's a shorter one, but it should have, no, it should not. But literally, it's going to be a mayo stand cover, same way, and you just apply it. Okay. So I thought these were it, but they're not. These are just like the weights. Alright, and then you're going to have ENT, possibly some ENT split drapes. Okay, what these do is they add that final reinforcement, they add that fire retardant type material, and they also add coverage. Okay, so you can see we know certainly is blue. So this U drape shaped like a U will encompass eye. However the doctor wants to use it, doing bilateral. You can go put those U's wherever your site's going to be. U drapes or split drapes, guys, are my favorite drape because I consider this the universal drape. You can drape anything with a U drape. Okay? If you have two drapes, you can turn two U drapes into a fenestration drape. You can turn two U drapes into a transverse. You can go ahead and wrap a U drape around the head, so you can do surgery here. You can wrap it around the leg, so you can have the leg come out. So U drapes are universal. If you guys ever go to surgery center, they're like, we're running drapes. You guys got split drapes? I got you.
What about, can it be used for lithotomy?
Yes, they can. I just thinking about it right now, I was like, I never really used it, but I didn't know view drapes. You can do it. Yes. Okay. But definitely, U drapes is like your universal drape. Because you can just U off or circle or something. Right? So you definitely, for ENT, we're going to go over these U drapes next week when we start doing our ENT type draping. Okay. Definitely, that's one thing we're going to get out of next week for ENT is draping for ENT. Okay. So yeah, take a look at this pack, and then of course, Alcon. Have you guys ever heard of Alcon? Have you guys ever heard of contacts or have eye stuff done? Alcon is the #1 leading.
It's like the Mercedes.
So yeah, it's the most famous. They do have a lot of surgical equipment. Okay? So a lot of the stuff that's in here. Then you have tubing and blah blah blah, because you'll need to either suction something out of the eye or put gas or fluids into the eye. So we have a lot of tubing that will do those type of things. Same thing over here. There's a little pack. It's a vitrectomy pack. More tubing. Okay. It has syringes and blah 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 blah. We even have some monopolar cords in here, so we can do some monopolar type stuff in your eye. Okay. But there's also other tubings that will be for gas, so you can apply gas, lasers. There's a lot of different things we can use. Don't worry if you don't know this, guys. This is stuff you're going to end up knowing in your career. Right now, as a student, I just want you to know that there could be some sort of pack in your pack. Don't get surprised and be like, I don't know this. Because guess what? You don't know this. When you guys go to surgery, they're going to show you how to use these things. Okay? Even though they expect you guys to know this. It's like, if you guys don't eat the whole machine and your stuff, then I can show you. They don't know. So again, vitrectomy. Hopefully you guys know and understand what a vitrectomy is when you guys are meeting. So you guys got your lecture, right? I think I should. Alright, so this is a vitrectomy pack. We have the vitrectomy cords and tubing. Knowing that most of the time you do have the tubing, you need the instrument itself. Okay? So in this case, the actual vitrectomy knife, the vitrectomy needle is not in here. So you have to open that separately. It might be a separate item that you need to pick for this case. Okay? So, and of course, suction tubing. No monopolar or bovie here because the bovie is too big, right? So our ESU here is going to be something like in the vitrectomy septum you've seen. Maybe a wire or some sort of little electrode wire that goes into the eye. Okay? Alright, so this is a simple vitrectomy. On to the other little things that you guys might notice. Big difference here, right? You see the difference?
One has the Raytech.
They're both 4x4s. But one is a Raytech 4x4 for counting, right? Why do we count these? Because they use as sponges only. These other 4x4s are dressings. They used to dress the wound. Do we have these available? No, put them back into your bag. You need to use these so we can. Okay. Other stuff that we have in here. Were you guys able to go over the stuff over there? You guys just stood around. Stood around. Okay. So, for the morning class. Alright, so I'm going to have to remind them. So again in here, we have these, right? We can use these around the eye. These we're going to use on the eye. Okay, some of you guys have seen put it on your case builds, very good. These are Wexel sponges. Okay, these Wexels, they're different. These are of a cotton or polyester type blend. These are of a cellulose type blend. These will not leave lint behind. And you guys see that common thing? Lint is number one, right? Not leave it behind. So these right here are the preferred ones around or on the eye. Around the eye, and then you also possibly are going to have quality tips, right? Q-tips company. These are quality cotton tips. Yeah. Q-tip is like, you know, calling it a Whopper. It's a hamburger. So yeah, Q-tip actually is the company name for it. So these are your quality cotton swabs.
Okay, I was.
I mean, yes, everyone calls them Q-tip. Right? I know my aunt calls everything a Whopper. It's like, no, you're at McDonald's. It's not a Whopper. It's a Whopper.
Quarter pounder.
Hamburger. Exactly.
The worst Whopper
So,
ever. McDonald's.
it's embarrassing when she went and ordered a Whopper.
No, ma'am.
So, we can use these also. Okay, again, these are less frowned upon. These are yay. Yay, maybe, only if using around. Yeah, not on.
Question.
Yes.
Would those ones come in the way? Yeah, would those always come in this type of pack?
This is an actual pack. Not always.
Okay.
Again, remember, what have I said about these packs? It depends where you go.
Yeah.
It really depends where you go and what they order.
Will it always be peel packed?
It's always going to be available, that's for sure. If you're doing eyes, you better have some of these. If you go to a new facility and they tell you, hey, by the way, you're a surgical tech, right? Okay, you order for eyes. I never ordered for eyes.
Wexels.
Number one thing you can
Wexels.
order is VSS, right? The appropriate prep for eyes and Wexel sponges. Okay? That's for sure. And then you're good. Everything else, you can use Kelly's in 15 plates. No, okay, we still need to fix all that too, right? But at the very least, you should have these. So they should be available if you guys have eye. I mean, I've gone somewhere and I'm like, do you guys have Wexel sponges? No, we've always used these. Okay, when I ordered these, the surgeon was like, where have these been all my life? Where have you guys been all your life? There's other things besides your surgery center, guys. So definitely get to know these. Wexel is something you guys should know. Why Wexel again? Cellulose sponge compared to. Speaking of cellulose, Alcon likes to make this guy. It's not horrible, this thing is. You don't even know what this is for? Where's the trash bin here?
Looks like a used tissue.
There's a little gumdrop in there. This is actually your cleaning pad. Okay. This is your cellulose, also made out of cellulose. And this is a cleaning pad. Okay? Remind me to show the morning, guys, if you guys are here. So you guys not mind you guys got a test. You dip this in water usually. And then we'll squeeze it out. Just ready for the magic.
Is it gonna expand?
So remember those dinosaurs? Yeah.
Oh, he
Okay. So I'll pass this around. Nobody has covered, right? You guys know Put it on, you see how soft it is compared to that stiff piece of trash that was in there. Okay, this is a cellulose sponge for when you're doing microsurgery. You must have one of these to clean your instruments. You use a towel or lap, you're going to damage those instruments. You're going to see how small and delicate they are. You'll use something big, they will damage. I know you are not to use this as implants for a tympanoplasty or any sort of behind the ear surgery. I would let the surgeons do that. I've told the surgeon, no, you better order the right stuff. This is not made for that. And if they find out, your patient could sue for millions of dollars. Okay. So what doctors use is they like to use this to sometimes put into those areas to start cleaning out some of that extra juice that's in there, like fat and deposits. And sometimes they forget and they just tell the nurse, leave it in there as an implant. You are wrong. You should be using gel foam instead. This is close to gel foam. Is that what you're trying to say, Aaron? Yeah. Yeah. These are for cleaning the instruments. But I've seen it, not that I'm saying that it's wrong, he's giving me some tips. Is the surgeons like to use these as a gel foam instead. Gel foam is almost identical to this. Gel foam is meant to dissolve in the body to also absorb and then incorporate its own cells and turn into your cells. This is not. This will stay in there and cause occlusions and cause more of a cholesteatoma and cause you to go deaf. Okay? So definitely do not want to leave these in. These are only for that. I've literally surgeons, oh, this is nice. No. Yeah, just a little piece. The nurse goes, yeah, he's always done that. Not on my watch. Today you are not. Today you are not.
Does that
gel foam, yeah. So you guys read when you guys get to ENT and you see where it says gel foam, I know kind of what that looks like. Okay? So, yes.
So does that mean it's accountable because it...
No, it's not accountable. You do not even put it anywhere near the body.
Okay.
Okay? So it's not. What do we count? Things that go in the body, right?
Yeah.
If for some reason the surgeon bypassed you, you got it and then used it, all right, then you want to make sure you tell your nurse that this is somewhere written down in the patient chart. So this is only to be used. Okay. This right here, I don't know where it's for. I don't know if you want to hang it somewhere. Right? I honestly don't know what this is for. You guys, have they ever told you what this is for? To hang around the ears so you can clean while you're doing surgeries? I never known what that little
It's a
slip
cleaning
is
pad,
for.
a cellulose cleaning pad. That's what that is?
Yes.
Okay.
Okay. So this is
purse.
found in almost all your ENT pads, okay?
Oh, it does feel nice.
And the good thing about that is if it gets nice and bloody, just dip it in some water, rinse it, and it's nice and clean. It doesn't hold on to any cells like a gel foam. Gel foam will hold on to the cells. This thing does not hold on to cells. That's what's cool about it.
Wait, does it feel like really dry before you put the water in?
It's a sponge, but unlike a sponge has capillary action. This really, it doesn't work that way. It's pretty cool.
Maybe they put the little strap there to save money.
So, yeah.
They put the little strap there to save money, so there's no more extra they can put on.
Yeah, definitely. I wish I could have one of those for all my surgeries, so that I can have point of use cleaning. Those would be awesome, but they do cost money. Okay, those are scientifically manufactured to work. So guess what? It means it costs money compared to just use a lap. That's 5 cents compared to $50 or something.
That's $50?
So I don't know.
Oh.
I'll let you know. I'll do some of the research. I'm pretty sure.
Let's
it's
say, dang, that's a lot.
$5.95 compared to 5 cents.
Okay.
$5.95 goes a long way for a patient. Okay? So especially if this is $5.99, I'm pretty sure they get charged $10.99. Okay? Don't quote me. Look forward.
I'll cut it out.
Again, so cellulose. Okay. Again, the same way those white cell sponges is almost the same. All right. Some things you might have to is, of course, for dressing, can you use a 4x4 and tape? Sure. But sometimes we need to keep the pressure there. There might be sutures. We'll talk about sutures in a little bit. But the sutures are there, and if you keep on blinking your eye, it's going to cause irritation and damage to other portions of your eye structure. So sometimes we need to put a nice, stiff, strong thing. So you put it on there, tape it, so your eye doesn't lift up. You also don't automatically start scratching and messing up some of those things. So this Fox eye shield is not super cool like the Pirate, but it's actually to make sure you immobilize the site. Dressings are either to secure, to help with infection, or not help with infection, to limit infection, or also to immobilize the area so it doesn't continue to get damaged by movement and so on. So this Fox shield, and if you guys do well enough, you guys will get an iPad. Not Apple iPad, but your Kindle iPad, okay? So this is just a simple little oval dressing that you guys can apply. Luckily it comes in here. try keeping all this stuff together and possibly in order. Right? Again, what do you have? You have the eye, fog shield, and then 4x4 over it, and then cover it. So I have that ready to go. You guys will, oh, we do have one. So we do have blades for the beaver blade. I'll show you guys later.
Ooh.
This is like a tiny 15 blade. Okay? It's meant for microsurgery, not just eyes, but microsurgery. Alcon makes this one, so more than likely it's used for eyes. I have surgeons use this type for like finger surgeries. So you go ahead and alleviate some pulleys and some tendons found around your very first digits. But definitely, there is a blade. You will not have 10 blades for an eye pack. The biggest one you'll have is probably a
15.
15 would be the biggest. Okay? And also, you guys will have 18 gauge needles wide to draw medication. But you're going to have smaller or shorter needles. These are usually halves. The ones you guys have in your basic pack are usually 1 to 1.5. And these are the half of that needle. This is a half size needle. The needle is really about right here. And then the gauges are smaller, so it's usually around 30 gauge that you guys will be using around the eyes. So really being that yellowish or peaches type color that you guys will see will be like the 30. Then you have these guys, I forgot what size these are, but you see how small they are.
I can barely see it on the thing.
Gotta give you some fun with these. Alright, and again you're gonna see some things like this. Okay, because you are doing eye surgery, you have little needles. Instead of putting it back in here, sometimes you'll need to reuse that needle again and again. So these are to squirt the blood out, and then reuse that same needle. Sometimes they'll draw fluid, or even your vitreous humor. Sometimes they need to withdraw some of the stuff. They'll poke it in here and shoot it in there. You're going to see something similar to this in vascular surgery, and it's way bigger. So when your doctor's inserting certain things into your femoral vein and femoral arteries, it's going to get full of blood in the syringe, so they like to keep on using it. They'll just soak up all the blood with this little sharp rest. More wax cell sponges, of course, marking pens. You will have a bipolar type of wet field, Alcon kind of
Similar to ESU?
electrocautery unit for eyes. Okay.
Oh.
So electrocautery unit for eyes internally. Okay. This is a bipolar, so you're going to insert this into the eye and do certain things. Really rarely used nowadays. And if working around the eyes or plastic surgery, you have this guy. Please do not play with this. Okay. This is a hot pen. Yeah. This is battery powered ESU.
Oh.
Okay. So once you guys press on this, don't play with this. It'll turn really hot, and you guys see it start smoking there. It's starting to smoke.
I've seen them use it on like a toenail to like get blood out. Yeah.
So again, a lot of times why we use this, guys, is because it's not electricity. Okay? It's not the electric charge that we're looking for, it's the electric burn. It's like a hot stove, right? The electricity, you don't see electricity shoot up from your stove, right? You just see the coils get really hot because of the electricity. So it works the same way. Whenever you're working around nerves, whenever you're working around vessels that you do not want to damage as a spread, because remember, the ESU, if you put it in correctly, it gives you an electrical charge. So we have bully pads. This you don't need it because the heat is only at the tip and the heat will not disperse like electricity. Okay? In this case, it's an electrical charge to heat up the little rod that's here. Okay? Well, sometimes they'll use those around the eye so that you don't cause a disturbance to the rest of the tissue. Okay? So be careful when handling this. Please do not play with it. If you're caught playing with it, you will get sent home forever. All right.
Bye-bye,
And then you have
10,000.
some labels that are by themselves. Okay, again, it usually comes in a little pack. If we're running out, guys, grab those labels and cut them in 4 ways, and you guys will have labels. Alright, so there's a lot of things, and some of you guys say, what's this? To be honest, I don't know what's the student inside this pack. I know this is used for ENT. Okay? This is actually a GU type supply. This is a catheter for urethral draining. This is a red robin catheter. Okay? Red robin catheter gets inserted into the urethra. So you can go ahead and do a clean patch specimen, or so you can just evacuate the bladder. Why is this here possibly? Well, during ENT or head and neck procedures, this is applied to the nose. It comes out of the nose, out of your mouth, and then you dry that, so you can pull you forward in your drop and drop, and you can remain open. And your pharyngeal airway is not open also. Still, I don't know for eyes. The only reason I can say for eyes is if we also need to drain, because you do have a dacryorhino cyst here, and you drain your tears into your nose and into your nose to the back of your pharynx. So this is the only idea that I can say is possibly there, so you guys can have it for eye surgery. So this is mainly for that. Vitrectomy, maybe not. There's got to be some reason for it. You don't have to ask who made this pack, why they ordered this thing. So that's pretty much what I can think. This is where I want you guys to think also. When you're setting these things up, this is what you should be thinking as a surgical tech. Why is this here? Let me look at the anatomy and physiology of the relevant area and see how this is going to fit in my surgery. If not, when I throw this away, no, always hide it somewhere in your, I don't need this because I don't know what it is, but maybe later down the road when I need it, I'll make a mistake if I throw it away and then my surgeon asks where it is and then tell them I put it away because who knows.
Pile.
So, make sure you guys keep everything and anything on your field. Just keep it towards the distance, right? So this is a simple setup. Eyes is very fast and quick and easy setup, but it is a lot to know too. It's not basic. It's nowhere near basic. You still have basic elements, but there's a lot of other little things. So we'll go ahead and set up that mail stamp for you on Thursday, so you guys can see what are the possible instruments you might need. We're gonna go over those instruments also. What else? Any other questions that we might have here?
Oh.
Yes.
Why is the marking pen measured a lot longer for the ophthalmic?
I don't know.
Okay.
There's no real reason for it. It's just a marking pen. Whether they decided to order that one or the next company is whatever they want. So it's nice when you have more measurement than. Okay? There's other instruments that you do use here for eyes. And it's going to be an instrument type caliper we'll use for measurements. Okay? Could be. Again, a vitrectomy can be anywhere from 1 minute till 2 hours. So, and we'll go back to you later.
The marking pen is on the eye, or is it like solution that doesn't have
The marking pen, here's the several ways to use your marking pen. Either you actually mark on the eye, and you'll have a caliper that does that. You'll use the ink from the pen and apply it to another instrument. You guys ever, like a tattoo machine, you grab the ink and apply it to something else and then you press it onto something and it gives you like a circular type imprint, okay? So a lot of times you'll use the pen and actually just color around the instrument, and the instrument is then applied, giving like a tattoo type effect, okay? Because you don't want to go in there freehand it, you'll pretty much already pre-mark something like a stamp almost, okay? Yeah, your doctor's gonna have a lot of different techniques, So again, guys, your surgeries in eyes can go from somewhere to nowhere really quick, okay? Again, cataract is nice and safe. We've done that so many times now. It's pretty much, people can do it in their sleep type cataract. Okay, they literally, I've seen 15, 20 plus cases done in one day. Literally. And this is, I'm talking about from like 7 till like 1. That's the day it was done. Yeah. Our techs got to go back. You did eyes too, right, John? Yeah, some of our techs got to go back there and said, you need one more specialty. They came back the next day, done. Because they did it all nice. They did 10 plus surgeries. And you guys can't do that again. Some of you guys might get the chance to do eyes, some of you guys might not. Eyes, again, know that it's a complex structure. I'm going to go over it back there, like I have to mention on some type of eye right there. It can go from somewhere to real quick. So, in this case, being a vitrectomy is to fix any type of puncture in the eye. Okay? If anything, if you guys don't do eyes and they put you on call, this is what you guys should learn how to do, is a vitrectomy. Cataracts is nice because there's a big market for cataracts, especially around here. Loma Linda population's a little older, so we're gonna have a lot of cataract surgeries to do around here. Okay, but yeah, cataracts, vitrectomies, and then strabismus surgery is the main surgeries you guys will possibly do in eyes. Anything else is really rare to do eye surgeries. Okay? So vitrectomy is gonna be your emergency situation. Cataract is going to be to get rid of the lens that's inside your eyes. And then strabismus is going to be to correct things like lazy eye, wall eye, blah, blah, blah. There's names to that too, I just didn't study that right now, sorry. But there's names for all those directions. So again, we'll go over all that on Thursday. We'll reinforce this a little better, have you guys set up And some of the machines you might need to. We found a lot of stuff for eyes, so we'll show you guys a little bit more. We'll have a show and tell. I'll have you guys do a show and tell. And then we'll do a show and tell for you guys. Okay?
Bring my teddy bear.
Is that?
No.
Alright, also here in the middle, I do have needle setups. Okay, we're going to go over the needles first, what to expect, and then you guys are able to touch this. So please do not touch any of these. Okay? If you guys make a mistake, we're probably going to lose the needle, and we're going to be here until we find the needle. And I want to leave on time. Okay? So don't mess with these in the middle. Let's go over to your instruments.